There's a lot of energy and a lot of interest in interprofessional education. Colleagues were really engaged, and there were some common challenges which we have to overcome.
The importance of identifying frameworks that we can use to find common ground, and also some of the last comments from the discussion just now around focusing on our professional identity as clinicians and as educators and looking for commonality there.
The sort of need for buy-in from different professional regulatory bodies, from accreditors, from senior managers. So I think what we need to think about is really engaging those types of stakeholders, because those are crucial to developing and expanding the field.
I think that the preparation and support of teachers is absolutely vital. And I think that this should be embedded in any interprofessional initiative. I don't feel you can actually start some initiative without preparing the teachers and the facilitators in advance.
Thinking about the work that I'm most familiar with at the moment around health education in England, and we are actually making a concerted effort to create opportunities to promote interprofessional education, particularly in emerging roles. And I mentioned the whole area of credentialing, for example, in emergency care practice, whereby we're looking at the competencies of individuals, not necessarily their specific discipline that they come from, but their competencies, measuring those so that we can actually create opportunities for people to learn together across disciplines there. So that's a very interesting area.
We have attitudinal barriers where just because of our traditional ways of educating, people aren't used to this new way of bringing students from different professions together. But more importantly, we have big logistical barriers just in terms of competition for teaching rooms and other resources.
Timetabling, the space that's available for students in the teaching, and funding.
Money is not so much an issue in Germany as it is well funded, but nursing is a vocational training in Germany, so I would also say timetabling.
One thing that helped us a great deal in the US is having education regulators nationally establish guidelines that required IPE, and that really changed the dynamics for us, and it doesn't seem like something like that is in place in the UK. Perhaps married to that is resources, so it certainly takes money to start up an IPE program. It takes some money to sustain it. It takes much less to sustain it than it does to start it up, but it seems to be a recurrent theme that the resources to make that happen aren't present. And I think the final thing is having high-level champions. So institutions that don't have somebody at the top who support it are going to have a very difficult time sustaining a professional education.